home science. As you come to the end of your 4-year course in secondary school, we hope the knowledge, skills and attitude acquired will not only help you excel in your final examination, but also enable you to face the challenges of life after school with confidence. In Form 4, we shall cover the following topics: care of the sick at home, ventilation, fuels in the home, furnishing the home, food preservation, convenience foods, clothing construction processes, problems of the consumer, and consumer protection. Care of the sick at home is also known as home-based care. This is the attention given to the sick while under the confinement of the home. Reasons for caring for the sick at home: lack of enough money to pay the hospital bill, to allow the terminally ill patients to enjoy the comfort and company of family and friends. Some of these illnesses include HIV and AIDS, diabetes, cancer, and mental illness. The family members may feel that there is congestion of patients in hospitals and lack of enough staff and facilities to provide care needed. To avoid contracting other diseases such as tuberculosis and skin infection from other patients. To facilitate complete recovery at home upon discharge from hospital. Some illness can be managed at home with relative ease and may not need hospitalization, for example, common colds, flu, and malaria. Needs of the sick at home. The sick at home have various needs such as physical needs, nutritional needs, emotional needs, social needs, and spiritual needs. Physical needs. The physical need of the sick at home may be met by ensuring the following: clean room, clean clothes and body, clean bedding, well-ventilated room, appropriate furniture, physical exercises, administering drugs as prescribed by the doctor, and changing position for a bedridden patient to avoid bed sores. Nutritional needs. The patient should be provided with a balanced diet. This includes plenty of proteins, plenty of vegetables and fruits, small amounts of carbohydrates, little or no fats, and a lot of fluids. Emotional needs. This is giving hope and encouragement to the patient. This can be shown through hugging, giving flowers, gifts, or cards, counseling, and engaging them in conversation.
Yes, hello. Yeah, how are you doing? Naona unaendelea vizuri. Yeah. Sasa unakula vizuri. Yeah, make sure you eat well. Chakula ukimetoa usimanisha. Unabomoa yote. Yeah. Make sure unakula unashiba. Matunda unakula, maji unakunywa vizuri. Ndio at least mwili upate nguvu.
Social needs. Sick people feel lonely and would appreciate the company of loved ones. However, the number of visitors should be limited to give patient time to rest. Spiritual needs. Most people believe in supernatural being upon whom they rely on in terms of need. In sickness, every patient should be allowed to exercise their faith. This can be achieved through prayers, visit from spiritual leaders, reading of the Holy Book, and meditation.